Sorry. So, good morning, everyone, and welcome once again to the series of webinars sponsored by the Philippine College of Physicians and the Department of Health. For today, we will be tackling an important issue regarding getting back to work. We may have to go back to work despite the pandemic and even before an sorry. We may have to get back to work even if the pandemic rages on, because it will take some time for a reliable vaccine to be discovered and an effective treatment to be available. Meantime, the pandemic will likely last for several more months, and we cannot stay in quarantine forever or indefinitely. So we have to take care of ourselves, and we have to ready our workplaces, okay, for uh, uh, prior to the lifting or at least the relaxation of the quarantine in the country. Before we continue, I would just like to recap. What the vaccine, what this series of webinar has tackled in the past. Last week, Last Wednesday of last week, May 6, we tackled general principles of COVID-19 response. And Undersecretary Berhere from the Department of Health was with us last week. Friday last week, we tackled COVID testing in the Philippines. What are the plans? Where are we headed? Okay, again, Undersecretary Berhere from DOH was with us last time. Dr. Salvania also was a speaker during this webinar. Last Monday, we tackled COVID-19 management, lessons learned and challenges ahead with Dr. Isa Alejandria and Dr. Lenny Fernandez as speakers. May I just remind everyone that these webinars are available online. You can access a link to these webinars via this URL. These links are also available at the PCP website as well as the Facebook page of the Philippine College of Physicians. So for this morning, we asked the question, are we ready to go to work? Okay, and definitely we'll be providing guidance to all workers. Is Nina Berba online? Okay. To share with you the objectives of this morning's session, we want to emphasize the principles of work resumption during this time of pandemic. Specifically, we want to enumerate recommendations on the proper clinic setup and operations for physicians and clinic managers during the pandemic. We want to highlight infection prevention and control measures in the workplace for both workers and plant managers. These are for industries other than healthcare. We want to share pointers on how to assess risks for exposure to infection in the workplace. And lastly, we want to specify criteria for evaluation of fitness to work among employees of industries other than healthcare institutions. In particular, we want to specify criteria for fitness to return to work among COVID-19 patients who have recovered. And we want to provide pointers on how to reassure employers about resuming operations and protecting their employees. We are fortunate to have experienced speakers with us this morning. Our first speaker is Dr. Regina P. Berba. Dr. Berba is an associate professor of the UP College of Medicine. She is the chair of the Hospital Infection Control Unit of the Philippine General Hospital. Concurrently, she is the head of the Division of Adult Medicine in both the UP College of Medicine and the UP Philippine General Hospital. She is also an infectious disease consultant at the Medical City. She earned her Master's of Science degree in Clinical Epidemiology from the UP College of Medicine. She undertook her fellowship in infectious diseases from the University of the Philippines, Philippine General Hospital, section of infectious disease. She had her residency in internal medicine at the Medical College of Pennsylvania, and she's a graduate of the UP College of Medicine. Dr. Nina P. Berba. Our second speaker is Dr. Cybele Lara Abad. Dr. Abad is an assistant professor and a research collaborator at the Mayo Clinic. She's a clinical associate professor at the UP College of Medicine. She's an infectious disease consultant and the chair of the Infection Control Committee of the Medical City. She underwent fellowship in transplant infectious diseases from the Mayo Clinic and fellowship in infectious diseases from the University of Wisconsin School of Medicine and Public Health. She had a residency in internal medicine at Rush University Medical Center, a graduate of the UP College of Medicine, Dr. Cybele Abad. Our last speaker for this morning is Dr. Ana Sofia Victoria Salazar Fajardo. Dr. Fajardo is a national officer, currently the secretary of the Philippine College of Occupational Medicine. She's the medical director of Perpetual Health Medical Center in Binian. Concurrently, she is the assistant section head of the section of Occupational and Environmental Medicine of the same institution. She holds a master's degree in business administration with a special concentration in health from the Ateneo de Manila University. And she's a graduate of the University of Perpetual Health, Dr. Jose G. Tamayo Medical University. Ladies and gentlemen, Dr. Ria Fajardo. May I now call on our first speaker for this morning? I'll stop sharing my slide so that Dr. Nina Berba can begin her talk. Dr. Nina Berba. Okay, it seems Dr. Nina Berba. Okay. Dr. Nina.
Hello. I'm finally in. Sorry.
Okay. Thank you for accepting our invitation. You can begin your talk anytime.
Wait lang. Wait lang, wait lang. Wait, I got disconnected. What's happening? Oh my God.
Nina?
Figure it out. Share.
Nina, if you need a few more minutes, we can ask Dr. Cybele to...
Here na.
Okay na. Yeah, you're okay? Okay, some technical glitches. Our apologies to the attendees.
Can you hear me? Aldrin, can you hear me?
Yes, I can hear you. Yes, okay. I can hear you.
Sige. All right. So I'm going to start. I apologize. I couldn't connect immediately earlier, and that sent me to a major panic mode. So I'm going to talk very briefly about preparing our clinics to see patients again and to assess whether we're ready to go back to work. So I'll just give a very overview of what we know about COVID and how that might affect how we are going to prepare for our clinics. So as you know, the COVID-19, this is a very small organism. It's about zero point zero 0.01 of a micron. And since its discovery in the early part of 2020, it's caused a lot of problems globally. And by March 11, we've been on a pandemic mode. In the Philippines, we started to have this community quarantine in March 12, and we've been almost on 60 days of expanded community quarantine. But we think we need we need to prepare for or anticipating of the ECQ very soon. Okay, so the mode of transmission is mainly human to human, and it is spread from one individual, one infected individual, to many unknowing other people around him. So it starts off with what we call the droplet type of transmission, wherein respiratory secretions from the mouth or the nose of an infected individual may directly land on the nose, the mouth, or perhaps the upper respiratory tract of people around that infected person. Or infrequently, the droplets can fall onto surfaces and from there be picked up from by other people, and that gets into the nose, the mouth, or the eyes of other people around that person. So this is how I usually show this slide to many people who listen to my infection control lectures. And very clearly, we see the large droplets falling either directly to the persons around him or to the environment around that person. This is a modeling or a conceptualization of where the virus might go from an infected individual. This is the person near the sink, and where the droplets, infectious droplets, may end up either around directly around that person or places or things that that person may touch eventually. Okay. So some uncertainties, no? So panay natin tinatanong, is it by airborne? So far we just have some data from experiments that the virus could be viable for more than 3 hours and actually can travel for some distance beyond the usual 3 feet that we know droplets to fall down to. And then there's also some other experiments by the group of Doral Malen that tells us that the virus, if left in the natural environment, can actually survive for periods of time. And that translates to a picture like this that I borrowed from Medscape, that some surfaces, if we do not clean them, can allow the virus to survive. Things that are very familiar to us and very common around us, yung plastic, diba? Dami-dami yung plastic. Steel, wood, glass, paper, things that we write on, and of course our very own surgical gloves that we like to use. Okay. So if you ask exactly ano yung stand ng WHO about whether are we going to just practice airborne versus droplet precautions, the WHO will insist that so far, even if in experiments we have seen that it may be airborne, right now we believe that for most part it's droplet transmission, but in certain situations in the clinics, if you start to do aerosol generating procedures, that airborne precautions need to be practiced because the possibility of airborne is there only in that situation. Okay, so there's more other data about this. This is a review and tells us that, di ba, usually we think of droplet as just falling down after 3 feet from the person who's infected. But here in this review, they've seen that there's some evidence that it can actually travel. The droplets that have dried up and are now called nuclei, droplet nuclei, that they could perhaps travel farther than what we're usually than what we are used to knowing. Okay. So other places that it can transmit to, pwede rin daw sa stool at saka sa blood, so that in our clinics or in our operations in the clinics, that might be important that laboratory personnel also wear PPEs if they're dealing with the stool samples, or the presence of the virus has also been documented in the blood. Therefore, things like needle stick injury might be something that we need to think about. But the transmission via blood is generally not believed to exist, actually. So very theoretical, and the risk is probably very, very low. Okay. So we also need to know actually when in the natural history of COVID-19 is the patient most infectious. No? So we think it's mostly dun sa start nung onset of symptoms. So kung siguro when we're planning out what does this mean to us, if we're planning out certain um, clinic schedules, baka dapat isipin natin yung context na a patient is most infectious half a day before and up to 1 to 3 days after the onset of the symptoms. Anyway, the PCP, thank you very much for inviting me, actually asked me to talk about recommendations on how to set up the clinic, and how to manage operations in the light of the pandemic perspective, and also to specify criteria for evaluation of fitness back to work. Okay, so the next few slides will talk about how to redesign your clinic, having in mind the things that I talked about in the first 5 minutes of this lecture. So siguro, why are we very afraid to open our clinics again after a rest period of over 6 weeks na, no? So I think it's really because of the fear that as healthcare workers, we might be part of, eventually we might end up as part of this census or database that came out we started to hear about this in April, no? This is data from April 22, and the breakdown of the healthcare workers in the Philippines who have been infected. So at that time in April 22, 16% of all total number of COVID cases were healthcare workers. But that has increased even more. So this is data from a few days ago, that now 19% or close to 2,000 cases are all healthcare workers among all the cases that we know in the Philippines. And ang top, almost the same, yung nurses and physicians are the main healthcare workers who end up being infected with COVID. So I guess this is really the fear that we all have and the situation that we'd like to avoid. That's why we're going to be really very careful about setting up our clinics. Kasi parang ino-open na natin yung doors talaga, di ba? To possibly all the opportunities na pwedeng mangyari to get ourselves infected. So in redesigning our clinic, we have to really be very, very careful to set this up such that those risks are down to the minimum. But there is parang trend that the amount of infection among healthcare workers are starting to really significantly decline. So this has been, if you watch, this is the latest from the DOH, you would see that towards starting ng May, halos wala na healthcare workers na nai-infect. So this is very, very good. So I guess it means all our vigilance and all our care for our healthcare workers are really producing the desired outcomes that we would like to see na zero healthcare worker infected with COVID. So where did I get most of the infection, most of the data you see for this presentation? So mostly from the CDC, sila yung parang pinaka bulk of the guidance on how to prepare your clinic. So they actually have this many IEC materials that we could download. And there's from the CDC, marami ng other essays and other media outfits that come out with their own interpretation of what CDC tries to tell us. So CDC would say na as much as possible, let's minimize chances for exposure. No? So sana hindi tayo makakita ng actual or unknowingly meron tayo palang patient na COVID na pala, tapos nandun siya sa clinic natin. So before arrival, it's important that our patients know that kung meron silang symptoms of what looks like COVID, wag na sila pumunta sa clinic nyo. That needs to be very clear for all. And upon arrival, somebody manages this, usually yung secretary natin yun, to ensure that really yung claim ng patient na wala siyang symptoms actually is there. At kung may symptom siya, parang ilalagay na natin siya sa ibang place. Do not allow them to wait with other patients, and supplies for masks and the hand hygiene that we know works must be present. So CDC would tell us na the preparation needs to go and happen way before your first patients arrive. No? So prepare your clinic, know who your patients, who among your patients are coming. Meron kang patient list. Hindi na tayo dapat nag-accept ng walk-in. So include in your plan a telemedicine appointment mechanism for patients to reach you. And if it's possible for you to just see your patients via remotely or via telemedicine, then that might be a fitting manner of dealing with your patients at this time. Okay. Stay connected and then assess and restock your supplies and other things like the PPEs, disinfectants, and maybe invest on influenza vaccine. Before your patients arrive, make sure nagkaroon na ng some communication. It doesn't have to be you. It could be your secretary. Ask patients about symptoms during the calls. And if they're really non-urgent, then reschedule them in a future date. Post signs at the entrances so that people know exactly what to do. So something like this is also again from the CDC reminding people, if you're like a standalone clinic, then nasa labas yan ng clinic nyo. If it's like a whole OPD department, then it's outside the building before they enter your elevators. There must be some signage telling your patients that if they have symptoms of what sounds like COVID, they should not enter the facility anymore and proceed to like an emergency room. Again, before the patients arrive, things must be ready in your clinic already. So, make sure there are supplies, yung alcohol, madami, maganda yung automated na alcohol hand rub dispenser. The sinks must have soap, there must be tissue around, there must be like hands-free trash cans. The waiting room must have chairs that are anywhere from 3 to 6 feet apart. Maybe barriers, di ba, yung mga acrylic screens if you want to do that. And remove things that are not needed in the waiting area like toys or reading materials or other things that are touched by different people at different times of visits. Now, it's also very important, I'd like to stress this, na before you open, kailangan nagkakaintindihan kayo ng staff, whether it's just your secretary or whether it's like a big group who's managing your operations in the outpatient department. So teach them about the coronavirus, about the disease, the COVID-19. Don't assume na they know. No? Kahit na ilang buwan na tayo into the COVID pandemic, don't assume that your secretaries know. You have to walk them through this whole, whether it's through a PowerPoint or a one-to-one discussion or a lecture. Talk about facility policies and what your practices will be. Surely it would have changed, so kailangan pareho kayo ng alam. So talk to your secretary or your staff about the job or task-specific information. Anong gagawin niya pagdating ng patient, saan po yung patient, saan uupo yung patient inside your clinic, things like that needs to be mapped out before you open. Also, talk to her or to him about how to advise patients about new clinic rules. So, if you would say na no walk-in, kailangan clear din yun sa secretary nyo, or that calling is necessary to get an appointment, or who to send to the ER. So, also about talking to the family. So, train your secretary also to advise, no? Kasi baka hindi kayo yung, kung ikaw, as a doctor, maybe you know many things, but maybe your secretary doesn't know a lot of things yet. So, teach her or him what you want to tell your patients kung siya yung sasagot ng phone, how to advise patients about preventing transmission of COVID, and also teach your secretary and your other staff about wearing PPEs. Okay? So these are some of what you might want to teach your staff. Mga myths, kasi panay ito tinatanong ng mga patient, ano yung pwede at ano yung hindi pwede. Like, pwede bang mag-garlic to prevent coronavirus? So all of these are also in the WHO website or other websites. Ano yung, kasi tatanungin niya ng patients and their families to your secretary, and nagchichika sila. So it needs to be clear kasi baka mamaya iba yung alam or iniisip ng secretary, baka nagbe-believe rin siya dun sa mga fake news or false truths. So tell them about things you believe in. Kunyari, patients ask, oh, pwede ba ako uminom ng ganitong vitamin C? So ano ba yung proper advice? Okay. There are also patients who will ask, oh, pwede na bang, mga ganito, things like, during the summer ba, mawawala na yung COVID? Yung mga basic things, kailangan your secretary knows about them too. Okay, so things like this are all, kasi baka tanungin sila ng patient, dapat tama yung sagot niya. For example, nung kailangan in rin with what's present in the news. So, kunyari, yung spraying Clorox or drinking Clorox based on news from abroad, kailangan may sagot din siya kasi baka tanungin siya ng mga families. Okay, next. There needs to be a plan about courtesy their patient. So, kunyari, the patient comes in and meron na siyang symptoms, meron siyang cough, ubo-ubo, naririnig ng secretary, may ubo, may lagnat. So, what will the secretary do? Wala ka pa, so hindi pa niya alam. So, there needs to be a plan where to place these patients with symptoms. CDC would say na there needs to be within that facility some kind of an isolation room. But most of the time, we don't have that luxury within our setup. So, ano na lang, advise the patient, and there must be a mechanism to do that. Paano niya ibababa sa elevator, tatawag ng wheelchair to bring the patient to the emergency room. Okay, the next one is about implementing engineering controls as part of the preparation. So, physical barriers or signages to guide patients, curtains kung kailangan. We want you to invest on new waste bins. Dapat hindi na natin tinatouch. Kung sira na yung basurahan nyo, it's time to change them because it's an important part of COVID care. I like the alcohol-based hand rub dispensers, yung automated, yung parang may sensor. That's good to have. at the front of your clinic, in the waiting rooms, in the place where you examine your patients, and in the restrooms close to your clinic. And of course, if there's a sink, have a soap dispenser with the stock of the liquid soap. When patients arrive, yan, what to do? Kailangan clear din yan. So, kung let's say walang mask yung patient, then you have to have ready supplies to provide the patient with a mask, and limit the bantay with the patient. Again, it's very important that patients are hindi sila magkakasama. Of course, all your patients are probably sick, kaya nga sila nasa clinic nyo. But those who are probably with what sounds like COVID needs to be really separated very quickly. Okay. For example, how we do our COVID clinic. Kasi may COVID clinic kami dito sa PGH eh. So, ang ginagawa namin, just that hindi sila magkakasama sa isang line. Sometimes they come in earlier than appointment. We really encourage them to come very specifically to the dot, on the dot. So, kunyari, may schedule kami. Let's say, Thursday yung clinics namin ng COVID. We have 9 a.m. and then 9:50, 9:30, 9:45. And then we ask them to really wait in the car. They're parked around the areas where we have the clinic, and you just ask them, o sige, baba na po kayo and come to the clinic. So it could be like that, no? So they don't converge together in the waiting area. Have a lot of personal protection. This is really for the staff, no? So a lot of alcohol around, PPEs. We'll talk about what PPEs. Yung PPE, ang tingin ko based on my best expert opinion, the one we need is really just surgical mask and a face shield. If it's a regular consultation. So, walang biopsy na gagawin, walang procedure, walang sputum induction, nothing. So, it's just a regular, maybe 5-minute consultation. Then, all you need, I think, in my best judgment, is a face shield and a surgical mask. Of course, if maybe you're a pulmonology specialist and you would be doing some maneuvers, then perhaps you would need to be better protected using an N95 mask and more. As I said, we need to really be very strict on infection control, follow standard precautions, droplet precautions, and airborne precautions if needed. Okay? We have to assume that every patient is potentially infected. So, hindi na tayo talaga sa clinic natin ng nothing. We need to at the very least, where sa PGH, we call it level 2. So, naka-surgical mask at naka-face shield for droplet precaution. After patients are assessed, we need to have a clear home care instructions. Maybe the next follow-up could be a telemedicine type of follow-up. And if the patient turns out to be a COVID suspect, then notify your LGU or your infection control committee or whoever is in charge of COVID suspects, no? Kung saan nyo sila re-refer. And after the patients leave, there must be, again, a routine already. The things that were touched or not even observed to have been touched, as things that are usually touched, like the counters, the chair, the examination table needs to be disinfected very quickly. So again, kung hindi tayo masyado into disinfection in the past in our clinics, now is the good time to review all our disinfection mechanisms. Think about dedicated equipment like stethoscopes, thermometers. Think about possibly disposable equipment, yung mga BP cuffs, and make sure that your secretary and your other staff and yourself are very much into disinfection and environmental cleaning. This is as important as your PPEs. Okay? So there are other sites that tell us na yung changes can actually be broken down into three. Changes as we prepare for our clinic to make sure that patients and us are safe. So that includes changes in the waiting room, changes in the patient flow, and changes to care utilization patterns. So changes in the waiting area, as we said kanina, kailangan parang very obsessive compulsive tayo sa thinking through what will the patient be doing in the waiting room. So again, look at cleaning everything that's probably touched by other people, like reception counters, kung may kiosk, pati ballpen, pati iPad screens if you use them, waiting area chairs, or even the elevator buttons and the doors and the handles of your clinic. Remove everything that could be removed, like toys and magazines. Tapos, arrange for the waiting room chairs to be at least, sabi nila, anywhere 3 to 6 feet. 6 feet is better, but 3 feet is acceptable. And consider having HEPA filters. Now, when you start looking for HEPA filters, the ones that could filter the smaller particles, the better. So, ina-assume natin, as I said kanina, 0.1 microns yung virus. So, if there are HEPA filters that could do the trick, then those are the ones that we prefer. Some people say, well, ang gusto mo naman rin tanggalin are the aerosols, diba? The droplets that are larger than 0.1. So, pwede rin yun. Basta, a HEPA filter is better than no HEPA filter. The second thing that we could change is the flow of the patient. So, as we said, pwede ba na we designate certain clinics? For example, as I said, yung COVID patients namin, we only designate Thursday clinics as for COVID alone. So, they don't come on any other days other than on Thursday. So, that makes it easier to not mix persons. Okay? So, or baka mamaya pwede rin you reorganize the time slot. So, pwede rin yung mga suspect pa lang, punta sila ng mas maaga, tapos yung mga COVID sa late. Or, yun nga, you reorganize time slots so for different patients. So, for example, maybe your HIV patients can come in yung mga immunocompromised patients nyo can come early, tapos after lunch, pumunta yung others. Parang ganun. Maybe the less sick patients can come early habang malinis na malinis pa yung clinic nyo and later on yung sicker ones. Okay. So, if multiple clinics are not available, then yun nga, designate different times of the day. Okay. The other one naman is changes to our care utilization. So maybe kung noon you would see 20 patients each afternoon, ngayon, let's do it differently. Our utilization of other mechanisms might come into play. So baka telemedicine might work for you. Imbis na you sit and stay in the clinic for 5 hours, you cut it down to 1 hour and the rest of the time are just remote consultation. So that's what we mean by changes in care utilization. The other one, for example, our clinic, clinic, which is an HIV hub, where
Hello,
in
Nida.
most of
Sorry.
yeah,
Your
malapit na matapos.
audio is choppy. Your audio is choppy.
Okay.
So,
very choppy ba? Sorry. Parang malapit na naman ako yata matapos.
Better na.
Okay. Okay. So, yan. For example, our HIV hub clinic, since it's mostly about distributing medicines, maybe this time they don't need to come in anymore. We can just arrange for couriers to send out the medicines to them. So, nag-iiba talaga yung kind of care that we can give. And of course, in your preparations, make sure that you prepare for absenteeism. So parang may in your mind some kind of what to do if your secretary gets sick or what to do kung ikaw naging sick. So yeah. Okay. There's a very nice review about BE or built environment to reduce transmission. So this is the article, and maybe if you have time or you're really looking for some answers to some questions that I may not tackle, then you can look into this. Okay. Sabi niya, it's very important that we look into the HVAC, heating, ventilation, air conditioning. So kasi one time I heard na somebody said, starting ngayon, dapat wag na tayo mag-aircon sa clinics natin. So, ganun ba yung kailangan? So, it said here na actually, we need to really think about all of these environmental controls. Definitely, have things in place like what we talked about kanina, yung having a lot of alcohol around, signages, soap dispensers, and all that. Tapos pati the design of the clinic, kung noon parang magkatabi kayo ng patient. Kasi noon, di ba, we have that kind of designs wherein to ensure there is this patient contact, we sit together in a sofa. May mga ganong clinics eh. But this time, maybe you'd like to change that because you'd like to reduce the risk of infection. About air conditioning, there's some data that tells us na kailangan ma-control natin yung humidity and temperature because that's all also affects the viability of the virus. So I think in response to that, we could keep on our aircon pero make sure that other things like ventilation is maintained. So merong exhaust and other additional things to clean the air. So wherever our patients are, we need to follow certain major rules na alam na natin. So as we plan our clinic, make sure that the patients and you are able to maintain physical distancing. That's rule number 1. And social distancing or physical distancing is very, very important. No? And this picture tells us na what happens without social distancing. So pag nalift na yung ECQ, anong pwede mangyari? At saka what happens with social distancing. Be sure na we have access to hand hygiene and it's in your clinic very visibly. Make sure also that you have adequate masks and your patients wear the mask correctly while they are in front of you. Okay, while the consultation is going on, tama yung pag-wear ng patient ng mask. So have this in your clinic and study these slides also. Yeah. And number 4, of course, to just review na kailangan talaga usually our clinics are small, hindi naman malaki. So yung mga items, madali sila matouch talaga whether by you, your secretary, or by patients. So make sure they are disinfected. Other things that you might want to have one step further, so you might want to have HEPA filter that assures that there's an exchange of 12 air exchanges each time. Pwede rin mag-defogging with a disinfectant, but I don't recommend that. And yung about use of UV light. So this one, sinasabi lang dito, I put this slide here kasi in the United States, there was this occupational risk score. And tayo pala, as doctors, we score 90 out of 100. So medyo mataas yung risk natin. If we don't take care of ourselves, baka we might end up having COVID-19 infection. But the ones that are really, really very high are the dentists and the respiratory tech. And this is what they said. Ito is from a dentist from India, and this just came out the other day. They believe and confirmed by all other literature about UV light is that maybe it really works. No, so if you have the luxury of purchasing one of these lamps, I will agree with that. Typically, 40 watt UV light na UVC yung wavelength na ginagamit. It's convenient, usually no chemicals, and it's very easy to use. Pero make sure lang that your secretary and you know what the precautions will be. And that by the time you turn on the UV light, that you are not there in the clinic anymore. Okay? I added this this myth kasi sometimes there's a lot of data about UV light and people misconstrue them na pwede rin pan-disinfect ng hands, but that's a myth. Okay? So if you have the luxury of purchasing one of these, hindi naman siya mahal. Ang preference ko personally would be a system that is on wheel. You can move from site to site within your clinic. May automatic on and off. Tapos pwedeng may timer. You can just put it at, let's say, 15 minutes. And that should be enough. Okay? And other things. So, for example, you're an administrator and you work, your OPD is like a big OPD department. So, baka you might want to consider further what we call the far UVC light. So, these are supposedly very safe. They're put in the ceilings and would clean out the air in large, high ceiling buildings. What about foot bath? Actually, I didn't find any evidence about it, but this is what's available. There's some technology facilities that produce it, and then there's some articles, usually from the Philippines, about why disinfecting the shoes is necessary. Pero actually, walang scientific literature that would support it. Okay, special populations, just that you identify special populations or patients that might visit your clinic and make the necessary precautions accordingly. Use of plastic, di ba sanay na tayo ng madaming plastic all around. Actually, sabi ng WHO that that's acceptable. Physical barriers using glass or plastic is okay. And ang bagong term pala sa kanya ay sneeze guard. So if your patients feel na parang some patients kasi might react negatively about having a barrier between you and him when they visit your clinic, sabihin nyo na lang that's it's called a sneeze guard, and it's really supposed to just protect the people around patients. Ang preference ko pala is something a little bit more permanent than plastics. Plastics tend to, as we saw earlier, tend to really hug a lot of bacteria. Baka virus maybe not too much, pero really it attracts a lot of gram-negative bacteria that might also infect you or infect your patients. Okay, so some other things that might be important is to also during your clinic make teaching your patients a part of your consultation. No? So things like gloves, di ba? Let's teach our patients kung ano ba yung use ng gloves and why it will not be good to use that 24 hours of the day. And about prophylaxis. No? The myths about taking certain medicines that have not been proven to treat or prevent coronavirus. Okay, I'm almost at the end of my talk. These are some more myths that I put together. Ang pinakamahalaga, I think, that you have to teach our patients is that COVID-19 should not be thought to be a death sentence. And in fact, make them believe that a lot of coronavirus disease actually are mild and get better. Because when they think it's a death sentence, they might not volunteer some of the symptoms immediately to you. So some take-home points. This is a checklist to just go over to make sure that your clinic is ready. Now, of course, number one, surely there will be some changes in how we're going to do our clinic. So have that already, whether in your mind or written down, like what's new in patient flow, triage, treatment, and design. Put in place your engineering controls already. So kung hindi pa kayo bumili, bilhin nyo na ngayon. Make sure that your PPEs are complete. Estimate how many PPEs you need, how many hand sanitizers you need over the next few months. Make sure you have boxes of surgical masks and have very clear cleaning routine in place. These are checklists again of that came out that was suggested by the American Academy of Family Physicians. So, yan, PPEs, clear signages, alcohol sanitizers, box of disposable tissues, no-touch waste bins, appropriate disinfectants, medical supplies, and very important, handouts, posters, and other patient education materials. Yun. I picked this up from the Rapplers. Ito yung example of how we do. This is Dr. Judith Jimeno who opted to keep her clinic open in a town in Iloilo. So that's very good, no? Kasi di naman lahat na patients natin ay COVID, and there are many patients who really need us at this time. So it's very good to start thinking about opening your clinics again because that's going to be good for your patients. These are basic. We can stop COVID. And minsan, meron ganitong klaseng mga magazines and literature that try to guide us through and help us survive through this very difficult COVID-19 pandemic era. There's a question about when to clear. So at this time, paano ba natin sila i-clear? Ang very clear in my mind is if there are tests, make sure na negative sila twice, tapos wala nang fever and there's been improvement in respiratory symptoms. If there's no tests, patients are in very remote places in some places in the Philippines, and it could be symptom-based. Basta magaling na sila for 72 hours and it's been 10 days since the first symptoms. For non-hospitalized patients, remember, very early on, some of them were very mild. Who can we clear back to work? So, basta there are no more symptoms, nakalipas na yung 3 days, 72 hours since recovery, and there's been 10 days since the symptoms appear. If there's a test, then look for 2 negative tests, RT-PCR tests. Again, no symptoms, and it's been 72 hours since the resolution of the symptoms. That's it. That's it, guys. Thank you very much for listening.
Thank you very much, Nina. Is my audio okay?
Yeah, I can hear you. Yeah.
Okay. For our attendees, please reserve your question for later. Please type them at the Q&A portion at the below your screen. We will try to answer your questions at the end of the webinar. For those asking if we will have this online, the webinar will be available via YouTube. We will send you the URL link during this webinar. You can also find the link at the PCP website as well as the PCP Facebook page. Okay. So may I now call on Dr. Cybele for her talk related to COVID-19 and our readiness to get back to work.
Good morning, everyone. Let me just prepare my slides. If just as a reminder, there's an echo, so please mute your microphones. Good morning. I hope you can hear me okay. I was asked to talk about the readiness to return to work from a non-healthcare worker setting. So these are the following objectives. I am going to highlight infection control measures in the workplace, again, for non-healthcare workers. I will share pointers on how to assess risks for exposure and infection in the workplace and go over some methods to reassure employers about resuming operations and letting them know that they are in fact ready. So there's a lot of crossover with Dr. Berba's talk because really some of the methods are the same. So let's go over the infection control measures first. And I want to reassure everybody in the non-healthcare setting that simple infection control measures work. And I know Ma'am Nina started with or ended with the UV light, and not everybody can have this in place. So instead, we should go back to the basics, and all employers should implement good hand hygiene, which is really the cornerstone of infection control and other infection control practices. These now include social distancing, as you've heard, frequent disinfection, and having your masks on. And we'll discuss these one by one. So hand hygiene. We all know how and when to wash our hands, but really I've noticed that people will not wash their hands if it's not convenient for them. So the workplace should be ready for hand hygiene. The employer should provide everybody in the workplace, so whether it's a worker, a customer, or a visitor, with a place to wash their hands. If the sink or the basin is not readily accessible, we can't always provide this in the right area, then perhaps provide disinfectant wipes. And more commonly, you can provide alcohol-based hand rubs or alcohol dispensers containing at least 60% alcohol, ideally 70% or more. These should be strategically placed, and I'll show you examples later on. They should always be full and in working condition. I have noticed in the healthcare setting that if these do not work, the healthcare worker will not take the extra effort to go and look for one that is working. So make sure all of these are in working condition. And also post hand washing signs everywhere so that people are reminded to wash their hands. So something that is attention grabbing, such as this one. Well, did you wash your hands? Stop and wash your hands first. And these are some strategic places in the workplace by the entrance. So as people come into your workplace, there should be an alcohol dispenser there. Dr. Berba mentioned automated alcohol dispensers, although these are a bit more expensive and need to be mounted. So you can just use your regular alcohol dispensers. Put them by everybody's desk so that when people are typing and writing, they look up, they're reminded, oh, I have to clean my hands. Also by the kitchens where people tend to gather when they're about to eat their meals, please put alcohol dispensers there. And some other high-touch areas in the work area. So if you have an elevator, outside the elevator where you wait for your elevator to come, or outside and inside the restroom, especially if running water is an issue. Now, corollary to this, you should also provide everybody in the workplace with a proper manner to dispose of their trash. So trash cans and trash bins should be easily accessible throughout the workplace. The trash should be emptied frequently. What you don't want to happen is to have spillover of trash everywhere in the workplace, increasing the risk of contamination. And then segregate your trash if possible. If you wear masks, and you should be wearing masks and or gloves in the workplace, there should be disposed in properly marked bins. You can either label the bins or you can change the color of the plastic lining to something that attracts attention. So drop your possibly contaminated things in these bins only. So moving over from hand hygiene to social distancing, and this has been reiterated also in the prior talk, we should also continue to social and physically distance ourselves in the non-healthcare setting. So even outside of the clinics, and this means 1 to 2 meters, right? The ideal is 2 meters or 6 feet. So in this manner, you should, as employers, encourage flexi work and flexi time. So now you're actually promoting people to work from home rather than trying to ask them to come in. So if face-to-face is not essential, please ask them to continue to work from home. Encourage also flexi time. We'll talk about this more later on. So stagger your workforce into shifts in order to allow themselves to distance themselves from each other so that it's not a crowded workplace. You should also prepare your workstation. So your people are prepared to be 1 to 3 feet apart, but their workstations are not. So you should also distance these workstations. So if you have very tight cubicles, for example, maybe just don't use a cubicle in between and do alternating cubicles. Also, make sure that you have specific workstation assignments. Do not allow a game of musical chairs, for example, where people sit here today and sit somewhere else tomorrow. They should be assigned to a specific workstation. Discourage workers from using other people's desks, offices, or phones. So you have to be a little bit selfish and recognizant that sharing is not allowed. But if sharing is necessary, then frequently disinfect these objects. So how do you disinfect these objects? So you should talk to housekeeping. Make sure that there are routine cleaning and disinfecting of surfaces, equipment, and other elements of the workspace. And for a non-healthcare setting, 70% alcohol or more will suffice. Or if you're kind of very paranoid, you can actually do dilution of bleach, and I'll teach you how in a moment. You can prepare your own bleach properly diluted. As a major recommendation, you should also disinfect at the end of each day. So when everybody has left the workplace, ask your housekeepers to stay behind and disinfect the entire workspace in order to prepare it for the next day. So these are some examples of high-touch surfaces, and I thought Dr. Berba showed this earlier. So doorknobs, door handles are very high-touch surfaces. Your cell phone, everybody's on their cell phones 24/7. Recognize that you have to wipe it off frequently. Your desk space, elevator buttons, your mouse, and your keyboards. These are always being touched by yourself and other people, so try to wipe them off frequently. And no one has really put down a number on how frequent is. In the clinics, for example, we do it after each patient encounter. So in your work setting, let's say you see customers, you can probably do it after each customer encounter, but tailor it to your own work practices. And this is your do-it-yourself or your MacGyver way of diluting bleach. So concentrate here on the right side of the screen. The one here that's grayed out in the middle is usually used for healthcare settings because it's a little bit more concentrated. So you want to dilute your bleach. So this is Clorox or Zonrox, which contains chlorine. You want to dilute it 0.05% so that you can use it to wipe off surfaces. And the way to dilute it is you can work off a 1:10 solution. So put in 1 liter to 9 liters of clean water. But if you want to start from scratch, you can do 1 milliliter to 99 milliliters of clean water, and you should end up with a 1:100 dilution. And remember that this is for surfaces only, so medical equipment, gloves or beddings. If you have a nurse in your work area, she can spray it in her gloves between patients. It should not be used for skin. It is a skin irritant, so it's really just for surfaces. Again, this higher dilution of bleach is mainly for the healthcare worker or healthcare setting because we deal a lot with spills and body fluids. Okay, so moving on to our next infection control principle or practice, everybody now, even outside of the healthcare setting, should have their masks on. And why should we wear masks? It really serves protection both ways. Earlier, we saw that if someone sneezes or coughs or even talks, there's really a spray of secretion. So having everybody wear masks in the workplace protects everybody. And this is a step different from earlier on in the pandemic when I remember only healthcare workers were asked to wear masks. But now that we have ongoing community transmission, everybody should be wearing masks. In the non-healthcare setting, a surgical or a do-it-yourself cloth mask are okay and will be enough to act as a barrier. This is another reason why we should wear masks in the community and why we recommend it. If you look at the graph here, and the one in red are those countries in the United States and some European countries who have not advocated for the use of masks in the community, and their numbers of coronaviruses are very, very high. In contrast, the countries in the Asian area, so South Korea, Japan, Singapore, Hong Kong, they have been advocating the use of masks in the community, and look at their numbers. Their numbers have kind of flattened out, and I think it helps diminish the transmission of COVID-19. So some do's and don'ts, and I think Dr. Berba flashed kind of the same slide earlier on, and here the print is very small, but remember when you wear your mask, wash your hands first, handle it by the sides. Once it's on, cover your nose and your mouth, and do not keep on touching and fidgeting the center of the mask because it then gets contaminated. When you remove your mask, again, remove it from the sides and dispose of it in specially marked trash cans, and then wash your hands again. So moving on to the next objective. So we've gone through some basic infection control principles, which you can use in the workplace. We can now assess the risk. This is the most important and probably key to trying to decrease the spread of COVID-19 is to promptly identify and isolate potentially infectious individuals. So we have to protect the workspace and everybody in the work environment. And how do we do that? I think it begins at home. And I think everybody should be doing this at home before you go to work, is to do a self-assessment. So you triage yourself at home. So before coming to work, fill out some self-assessment tools, and these are available online, and I'll show you some examples. This allows you to assess your own symptoms, whether or not you're a candidate for further testing or whether or not you should seek medical care. Unfortunately, clinicians do not have the testing capacity to test or see everybody for clearance. And I know that's an issue. Everybody wants to send everybody to the doctor to see if we can clear people, but that's really not tenable. It will overburden the healthcare system. And so if we can do self-evaluations at home, that will be very helpful. So these are some online tools. Excuse me. We do have a Philippine version and a version out of Mayo Clinic. The Philippine version, unfortunately, needs updating, and looks like it was done very early on in the pandemic. And so there were a lot of questions on foreign travel, which we know is no longer the case now that there's community transmission. But what I really like about it is it's available in the local language. So in Filipino, or if you speak Cebuano or Bisaya, you can actually fill it out in your own dialect. So I think that's very helpful. But since it needs updating, we hope to be able to talk to our tech-savvy colleagues, and Dr. Berba approached me about this as well. We have to modify it based on our own experience, and we do have a lot of a wealth of data coming from our referral centers, including PGH, RITM, Lung Center, and also from large private hospitals who have been seeing these patients, so Makati Medical Center, and the Medical City, for example. So we want to modify it to suit our own situation here. But until that is up and running, I want you guys to try this. This is out of Mayo Clinic. It's available online. Just Google COVID-19 self-assessment tool and Mayo Clinic, and it should come up. It will warn you that it's really based on US data and is based on expert opinion from the physicians at the Mayo Clinic. And they will say it's really for US residents. But I went through it. It's actually quite applicable to our setting here, some of it at least. And so they will ask you two important things for triage. One is exposure. Now, have you been in close contact, meaning within 6 feet of someone confirmed to have COVID-19 for at least 5 minutes? And have you been in direct contact with their mucus or saliva in the last 2 weeks? After exposure, they will ask you about symptoms. Which of these symptoms do you have? And you're allowed to click as many as you want, or you click none if you're not having symptoms. And there's also they encourage new onset symptoms. So if you've had, let's say, cough for more than 3 months, that's probably not COVID related. And then after you go through the triage, they will end up with some recommendations. Will you need to be tested, or you just stay put and you don't need a test? They will ask you also to reevaluate your symptoms in 12 to 24 hours if needed, seek urgent medical care, or just stay at home and manage your symptoms at home. So I think it's very helpful in terms of trying to assess whether or not you are ready to go back to the workplace as an employee. So if you can't do this, if you have a hard time accessing it, I also advise the workplaces, especially the bigger ones, consider setting up a triage area upon entry into your workplace. Focus on checking your symptoms and exposure. And then you can also do a temperature screen. And I see this, coming into the hospital or coming into a drugstore, people do check your temperatures. But I think it is optional because often it is actually done correctly. So if you want to do it, please teach the people doing it to do it correctly. And also the thermal scanners do have some cost to it. So if you cannot do it, you can focus on symptom check and exposure check. A big caveat to doing triage upon entry to the workplace is you have to make sure it does not cause unnecessary long lines. That's what you don't want to happen, is for people to be backing up into the entrance and they're no longer socially distant or physically distant from each other. So this is an example of a triage or a screening protocol. This is taken from the medical city. Again, a focus on signs and symptoms, right? You have a cough, fever, muscle aches, etc., or other symptoms. And then finally, questions on travel and exposure history. And this assumes, of course, that you're telling the truth, and we really want to encourage people to tell the truth. There is no blame. There is no blame game going on. We want you to encourage to tell the truth because it really protects everybody in the workplace. So after doing triage, we want to encourage the employers, please encourage everybody in the workplace to continue to self-assess themselves. So continue to self-monitor yourself for signs and symptoms of COVID-19. Please do not scare your employees. This really does not work, and really the people will tend to hide their symptoms if they're afraid. And again, as mentioned earlier, there's no need for clearance asking them to go see a doctor before they come into the workplace, as mentioned earlier. So how do you recognize the symptoms of COVID-19? These are the more common symptoms. So it's really fever, cough, difficulty of breathing, and sore throat. Some people will present with headache, myalgias, or body aches and weakness. And some people have atypical symptoms such as nausea, vomiting, or diarrhea. But you really have to take those self-assessment tools in order to kind of help triage whether or not you need to be tested. Now, let's say, for example, someone is in the workplace and develops these symptoms. So your employer, the employers have to be prepared. So consider designating areas with closable doors that may serve as isolation rooms temporarily until these sick individuals can be removed from the work site. So this has to be prepared before your doors open for work. Also teach everybody, as mentioned earlier, how to limit the spread of secretion. So everybody should be masked, and teach them about the proper cough etiquette. So cough into a tissue, proper disposal of that tissue, and then or cough into the crook of your elbow rather than your hand. And finally, I wanted to belabor this and emphasize this. Please, if someone develops symptoms at work, do not panic. Do not discriminate against these individuals. They probably feel very bad already that they're feeling sick, and do not incriminate them. So don't tell them, ikaw kasi bakit ka nagka-symptoms ngayon, no? So don't do that. Nobody wants to fall ill. Please just help them along and just work together. So if they do develop symptoms, do restrict the number of personnel entering these isolation areas. So once they're already isolated, do not allow a lot of back and forth. I know people want to check on people, so maybe they can do it remotely via FaceTime or online tools. So again, there should be a no visitor policy. So moving on now, are you ready to go back to work? I'm talking to the employers. So there's really ways to find out if you're ready. And the only way, the big way actually to do that is to be prepared. So prepare, just like a good Boy Scout. No? So have what you call a preparedness plan or what you call a response plan. Consider the physical space and the workforce, and we'll go through that. And my big suggestion here is before you fully open, try things out. Do a dry run, walk around your space, talk to your people, your teams, find out suggestions from the group, and see if things work or if they're already in place. So have a checklist as well. Also, consider the flow from home to work and vice versa. So let's say you're going to work. Do you commute? Do your people take public transportation? Do they need help coming in? Things like that. And then the vice versa as well. From work, how long does it take you to go back home? And try to look for strategies in order to decrease the amount of infection risk while you're traveling. You have to accept, there's no way around it, that operations will change. This is the new normal now. There's COVID times and pre-COVID, and we're now COVID times. Hopefully we get to post-COVID times. But the bottom line really is the safety of everybody in the workplace. So be flexible. So this is what I want you to consider with the workspace. So this is kind of your checklist. We've gone through some of them. Disinfect frequently. Limit in-person meetings. We're really moving towards telehealth or telemedicine, in this case, telework. Triage, as we talked about. And then if you have a big company, talk about delegating responsibilities. Maybe some of your managers can come up with their own preparedness plan in their smaller units, and then look over common spaces. So an example would be when you do a walk around. If you have an elevator, for example, make sure there's only a maximum number of people allowed in the elevator. So this is an elevator at the medical city, and we've outlined the people on the floor, put them in small neat boxes there, and then Be sure to post a lot of signages around the workplace to wear a mask at all times or do hand washing. So after considering your physical workspace, consider your workforce. And we'll go through this one by one to follow. Okay, so stagger employees is one of the big suggestions. So this is really the new normal, as I mentioned, telework. We really want to minimize contact among workers and customers and replace this face-to-face meetings with virtual communications and telework if this is feasible. Again, physical distancing is key. So if you have close or tight spaces, identify them right away so that you can avoid these tight spaces and maybe do things so that people are not congregating. We've also noticed that people tend to let their guard down around lunchtime. So stagger your break times because this is when people like to socialize. I realize that we Filipinos are very social creatures. We like to eat together. We like to take our meals for an hour, hour and a half, and everything is like a fiesta. But unfortunately, during COVID times, we have to avoid crowds. We cannot have prolonged socialization. There should be no congregating. And in order to avoid long lines in the cafeteria, for example, if you have a school or thinking about school, then you should probably encourage home-cooked meals or pre-packed food. And there should be a business-only attitude, even during lunch and even during recess. So incentivize your infection control processes or your personal protective equipment. People always like games and contests. So maybe to encourage wearing of masks, you can have a prize for the people who wear it the longest or wear it correctly. And then maybe prize for the most creative mask. But I would be very careful with this one because people are very creative. So maybe just this one here. And then maybe have a prize for an employee who washes his hands all the time. Maybe have hand hygiene employee of the month, things like that. Make it a little bit fun. And then stagger the workforce. You should probably establish alternating days or extra shifts that reduce the total number of employees at a given time. So don't ask everybody to come in at 8 o'clock to 2 o'clock. Maybe some people will come 8 to 2, some people will come 2 to 10. So almost like a call center shift, no? And then this will allow them to maintain distance from one another while maintaining a full on-site work week. So finally, travel and education. So for travel, if your travel is non-essential, you should discontinue or avoid it altogether because you don't want your people going into a community where there is COVID-19 transmission, where there's an outbreak. So please avoid travel to these areas, especially if it's non-essential. And also, finally, and this was mentioned, you should educate everybody. Everybody wants to learn about COVID-19. And I think online platforms, your workforce wants to learn, and you can do it together. So maybe schedule something online via webinar or whatnot, via Zoom every so often. So in summary, readiness to work is possible with emphasis on your basic infection control principles. So hand wash, very important. Disinfection frequently, so clean as you go. Socially and physically distancing ourselves from each other. Wearing of masks is no mask, no entry policy. And then preparation is key. Have a response plan or a preparedness plan. Go over your structure, so your workplace, and then go over your workforce or manpower. And then finally, educate everybody. And that is my last slide. The following are just my references. Thank you very much for listening.
Thank you very much, Dr. Cybele. Can you hear me?
Yes, we can hear
Yes.
you
Okay.
very
So
much.
thank you very much for that wonderful lecture, Dr. Cybele. I'm sure everyone learned a great deal. Just a reminder to all our participants, our attendees, our webinar is recorded and can be viewed at a later time. We'll flash the URL of the link later on. Um, Telemedicine has been mentioned quite a lot by both of our infectious disease speakers. We'll have a specific session on that, no? In the new normal. The webinar will be this Friday, and part of the that they will cover is IDOLE, DTI, or the Philippine College of Occupational Medicine. We do have a speaker from the Philippine College of Occupational Medicine uh, to discuss work readiness in this time of pandemic. May I call on Dr. Ria Fajardo, okay, a national officer of the Philippine College of Occupational Medicine. Ma'am?
Hi, Dr. Aldrin. Good morning. Can you hear me, sir?
Yes po, you can,
Okay.
you're audible. Thank you.
Okay, thank you. Good morning, everyone. So I'd first like to thank the Philippine College of Physicians for this opportunity to share the perspective from the Philippine College of Occupational Medicine. So are we ready to go to work? And our guidance for all the workers who are, of course, our patients as well. Okay. So for the general objective, we were given this objective to emphasize the principles of work resumption during the time of pandemic. And I will focus today on the specific criteria for evaluation of fitness to work amongst employees of industries other than the healthcare institutions, specifically also to specify a criteria for fitness to work, return to work, among COVID patients who have recovered, and to provide pointers on how to reassure employers about resuming operations and protecting their employees. I'd of course like to focus on the statutory and regulatory compliance, since our first two speakers have really discussed very comprehensively about guidelines for infection control in the workplace and before resuming work. So we of course like to emphasize that the DOH, the DOLE, the DTI, and the CSC are some of the government agencies that we rely upon for our guidance as well in the workplace. Okay, so this is our Bible, our Occupational Safety and Health Standards as amended in 2019, which was started in 1978 actually to safeguard our workers' social economic well-being as well as their physical safety and health. In 2017, also, there was a document released by the Department of Health, the Department of Labor and Employment, the Civil Service Commission, which is the National Occupational Health and Safety Framework for both the public and the private sector. So it focuses on institutionalizing occupational health and safety in both public and private sectors and providing the different government agencies a policy framework. Okay, and then in 2018, we have the signing of the OSH law, or the Republic Act number 11058, an act strengthening compliance with occupational safety and health standards. And we've had several, of course, incidences in the past wherein we see where there were some industries that were lacking full or strict implementation of these OSH standards. So now that we are in the COVID-19 pandemic, we do realize the importance of implementing strictly our occupational safety and health standards. So this is simply a guide of what an occupational health physician would be implementing in the workplace. So your occupational safety and health programs are they are designed by your occupational health physician, the health and safety committee, which you have, of course, to plan for and really know what your workplace is, what the hazards are in your workplace. And you would also have to present this to top management in order to have it implemented fully and followed strictly. Okay. So we have, of course, also some workplace classifications that we have to think about based on risk. Low risk workplace refers to those with less exposure to safety and health hazards, having low level of danger or less probability to cause accident, harm, or injury. The medium risk workplace refers to those having moderate exposure to safety and health hazards. And of course, the probability of having an accident, injury, or illness. And those with high risk workplaces refers to those where in the presence of the hazards affects not only the workers, but also the people outside the establishment with a high level of exposure to safety and health hazards, and the probability of a major accident is likely to occur. And just for those who are working, of course, in the healthcare setting, your healthcare facilities are included in these high risk workplaces. So I will also focus this lecture on the guidelines, the interim guidelines that came from the DTI and DOLE on workplace prevention and control of COVID-19. This was released last April 30, and it should be followed strictly by all workplaces. So it focuses on increasing physical and mental resilience, reducing transmission of COVID-19, minimizing contact rate, reducing the risk of infection from COVID-19. Okay, so this is just the example of the different examples of high-risk establishments. And for those, of course, who are not in the healthcare setting, you see here chemical works, construction, deep sea fishing, firefighting, mining, petrochemical works, the power industry or the energy sector, those handling hazardous chemicals, the storage of fertilizers in high volume, transportation, water supply, works that handle chlorine, and activities that are closely similar to those enumerated above. So here we have also what we call the hierarchy of controls. And this came from an article that was released by the Johns Hopkins Education Research Center for Occupational Safety and Health, wherein they applied it in the COVID-19 pandemic situation. So we all know that the topmost, wherein it is the most effective kind of control, wherein elimination is the strategy. Social isolation is the action that we are all doing and that we're all trying to implement. If you notice in most of the guidelines being released by the different government agencies, social distancing, physical distancing, this is one of their top priorities or pillars of implementation of infection control. Substitution is not applicable in this COVID-19 pandemic. Engineering controls, as mentioned earlier, these are the different ventilation, improving ventilation in the workplace, installing physical barriers, etc. And your administrative controls are those that can be, of course, changed or improved on by the management. So which is either you work from home, have a staggered schedule, and promotion of hand hygiene in the workplace. And if it's surprising for those who are not used to seeing this, that the least effective of all the controls in the hierarchy of controls is your PPE, because this is actually, you are already in close contact to the hazard. So in this case of the COVID-19, the biohazard is your coronavirus. Okay. So here we have the return to work interim guide on health and safety in the workplace. I will be discussing this one by one prior to going back to work, at the workplace entrance, inside the workplace, and going home. I understand our speaker, Dr. Abad, mentioned very comprehensively already a few of these. Okay. So as she mentioned, that prior to going back to work, plan. That is the number one thing that you have to do. You have to plan with your health and safety committee, with your pandemic response team. Of course, present it to top management, because if you don't present it to top management, it will not be implemented at all. And of course, we want to ensure the health and safety of all our workers. So plan, present, implement. Okay, so again, the engineering controls, these were mentioned earlier. Administrative controls, certain examples of these are identifying your vulnerable workers based on occupational health and services data. Of course, others are, the health screening protocol. It must be implemented strictly if we want to make sure that our workers are really coming to work without any symptoms of COVID. And we have to ensure also that when we work with our health and safety committee or the pandemic response team, we include all of the stakeholders in the workplace, which includes your labor relations, the labor union, the HR, your supervisors, your managers, etc., and other members of your health and safety committee, which of course would include your occupational health professionals, like your occupational health physicians. Okay, so your vulnerable workforce, as defined in the guidelines, are those with high-risk pregnancy. Some would actually say even those who are not high risk should actually be given some kind of different work accommodation. Those who are 60 years old and above, any age with comorbidities or pre-existing illnesses wherein you have uncontrolled hypertension, uncontrolled diabetes, recurrent asthma attacks, COPD, blood dyscrasias, liver and kidney disease, and those with immunocompromised status. So, of course, we don't want to, we don't want to try to set aside people who are vulnerable, but yet will contribute so much to the work because they have the expertise that we need also in that workplace. So hence, with these most at-risk workers or your vulnerable groups, we must be able to develop work arrangements to ensure that they deliver still the work that is expected from them, and that there shall be no diminution of wages and benefits. Okay. So with regards to transportation, we, of course, ensure physical distancing, use alternate seating arrangement depending on what kind of vehicle is being used. Always wear face masks. And of course, it is preferred that free shuttle service should be provided if public transport is not available, which is what is happening right now. So in entrances, of course, no mask, no entry, accomplishment of your health symptoms questionnaire, temperature check, provision of well-ventilated holding area, and designated health officer should provide appropriate PPE. And if you have a disinfecting foot bath in all entrances, please also have a dry rag beside it. This is what I just noticed with some of the foot baths that we've been seeing in the workplaces. It's just you simply pass through the foot bath, but then there's no place to dry your shoes on. So please ensure that there's a dry rag also beside the foot bath. So placing hand sanitizers in multiple locations. This was also mentioned earlier. Okay, no mask, no entry. And this is a sample of the health checklist. This can, of course, be modified depending on company policy. If they want to ask more questions, if they want their employees to declare something a little bit more than these basic questions, then of course, by all means, the Health and Safety Committee can recommend. On elevators, of course, we know for now, if you can, use gloves if available, or avoid touching the buttons with your bare hands, use your elbows, etc., or a ball pen, and then follow physical distancing markers facing a wall, and frequent disinfection of high-touch areas. Of course, that is care of our housekeeping or janitorial services. Okay, so for those, when you are already at the workplace or at the entrance, then of course you need to ensure that the queuing is there's social distancing, 1 meter radius, front, side, and back. Floor markers are very much going to ensure that this is being followed. Floor markers, or you put chairs in place so that your employees are really distanced. Hand washing stations, if available, alcohol dispensers again. And when there's a temperature check, okay, so if you have temperature of 37.5 degrees and above, you isolate and recheck the temperature after 5 minutes. If it is still 37.5 degrees Celsius and above, then the employee will be brought to an isolation area, which is not the clinic, preferably not the clinic. It should be with other companies. The best practice is outside the establishment. So, and when you see the health checklist or the daily symptom questionnaire, if any of them checked those symptoms, then they have to proceed to the isolation area as well. So also, it's very important that our company clinics or our companies call the DOH or their MHO, CHO, or BERT for coordination once any of their employees show symptoms of COVID. So, of course, if their symptoms are mild, send them home, give them medical advice, refer, of course, to the MHO and CHO. Preferably, you use the company vehicle when they have to be sent home. Okay. If none of these are present, they may enter the workplace. Of course, they enter the workplace by disinfecting first their shoes or their footwear, and hand disinfection, and the mandatory use of their face mask. When a company has to have biometrics, clean hands before and after using the scanners, photocopy machines, shredders, ATMs, etc. So while inside the workplace, okay, I'll go through this one by one with my slides. Okay. So this is just a sample of signages, of course, that we have to show in strategic areas in the workplace. Okay. So in the work area, we ensure, of course, that social distancing is kept either at the minimum 1 meter or 3 feet, or more ideally 2 meters or 6 feet from one another. So the goal is, of course, while you're in the workplace, you work together, but you have to stay apart. And here's a sample of a cafeteria with physical barriers. So they're using either this is glass or plastic barriers. They may be sitting in front of each other, but the physical barrier ensures that their infection control is maintained. In restrooms, okay. So preferably if the paper towel is available, use it before washing your hands as recommended by Cleveland Clinic. Follow proper hand washing technique. Avoid the air dryer, if possible only avoid the air dryer, and use a paper towel to turn off the faucet and to open the door. Okay. And these are the CDC recommended situations to do your hand washing: before, during, after preparing food or eating, before and after caring for someone at home who is sick, before and after treating a cut or wound, of course, after using the toilet, changing the diapers, blowing your nose, sneezing, touching an animal, handling pet food, and touching the garbage. And before going home, what do we do? So dispose, if your PPE is disposable, your PPE or your mask must be placed in a separate plastic and disposed in designated infectious bins. So these are your bins with the yellow plastic. After using washable mask, it must be kept in a closed plastic bag. Refrain from putting it in your pocket or inside your personal belongings, because we all know that the virus can stick to the outside of the mask. Refrain from kissing, hugging family members. When you get home, take a bath first. Discard in a separate hamper your used uniform or outfit away from family members, or immediately soak in water with detergent. Some workplaces, they do also take care of the laundry of their workforce. If the company has enough funds to do it, by all means, it is recommended. Essentials brought home like ID tags, bags, keys, etc. should be securely placed outside the house, or disinfect them if you really need to bring them inside the house. Frequently clean cell phones and gadgets. Put it in a Ziploc plastic for easy cleaning, and follow physical distancing in the vehicles or any form of transportation. So in exits, what do we also do? Somehow similar also to your entrance. Do hand hygiene before leaving the workplace. Foot baths are also being done before leaving the workplace. Make sure that you have a unilateral flow of traffic using stairs or pathways if feasible. If you have, this is also having different entrance and exit for employees and visitors is also ideal, but if it is not feasible in your workplace, the security must ensure that those going in and those going out, of course, are not doing so at the same time. Okay, so this is table for the worker exposure risk to COVID-19. This is similar to one of my slides earlier regarding the low risk workplace, the medium risk workplace, and the high risk workplace. And if you see at the very bottom is your very high exposure risk, wherein the healthcare workers are there, your morgue workers, those performing aerosol generating procedures, or handling specimens from potentially infectious patients or bodies from people known to have or suspected of having COVID-19 and time of death. Okay. So what do we do when a worker gets sick or has fever that is not COVID-19 or that is not declared to be COVID-19 by your OH physician? The employer should advise the worker to take prudent measures, of course, to limit the spread of communicable disease, stay at home, keep away from work or crowds, take adequate rest, plenty of fluids, practice personal hygiene to prevent the spread of this disease. Okay, seek appropriate medical care if the fever persists, they have difficulty breathing, or have body weakness. Okay, if the worker is a COVID suspect, so the worker shall immediately proceed to a designated isolation area, like I said earlier, preferably outside the building and not necessarily in the clinic, in the company clinic. So ensure that he never removes his or her mask. So the clinic personnel attending to the worker should wear appropriate PPEs and, if needed, require transport of the affected worker to the nearest hospital. If PCR testing is available, it should be done and results should be reported by the hospital to DOH. So, to reduce the risk of infection from this COVID-19 worker suspect, they have, the company should decontaminate the workplace, okay, by using appropriate disinfectants. Then after this decontamination, work can resume after 24 hours. So workers present in the work area where the COVID-19 suspect shall go on home quarantine for 14 days until such time that the results of the PCR testing are turn out to be negative. So return to work criteria for our OH or company physicians. For recovered COVID-19 patients with no comorbidities, we would like to request for medical clearance if hospitalized from their attending physician, whether from their infectious disease specialist or the pulmonologist. If home quarantined, clearance from the MHO, CHO, or the BERT. And of course, they have to present an RT-PCR with 2 negative results. For those recovered COVID-19 patients with comorbidities, the same as what I presented earlier, but of course, maybe additional medical clearances from their other specialists who are managing their other respective medical concerns. And of course, again, just to emphasize, emergency preparedness and response to COVID-19 plans. They have to plan before resumption of work. They have to make sure that they have the isolation room, preferably outside the company building, wherein they can either have a tent or have a quarantine facility, wherein the occupational health physician, the occupational health nurse, or the emergency response team will be coordinating within their workplace or within industrial zones. For referrals, of course, again, coordinate with the nearest COVID designated hospital. So this is also an advisory that we released to our members. What I mentioned earlier is all here. This is simply an infographic that would be easy to use for or easy to read by our workers, whether at their workstations or in strategic locations around the workplace. Okay, so workers' right to know. It is the workers' right to safety and health at work. It is also the workers, all workers should be appropriately informed by the employer about all types of hazards in their workplace and they should be provided access to training and education on all of the safety protocols necessary for their kind of workplace industry. Okay, so the workers should also train their new hires, okay, for all the hazards in the workplace, and reorientation on safety and health for workers should be done regularly in high risk establishments. So not less than once in a quarter, to be conducted immediately following any changes in operations and production process. So actually, in these times of the COVID-19 pandemic, there should actually have been a reorientation on the safety and health for these workers in the high risk establishments. So the workers' right also to personal protective equipment. All PPE shall be of the appropriate type, tested, approved by DOLE. Use of the PPE and project sites and other places where work is being undertaken shall be based on the evaluation and recommendation of the safety officer. All PPE must be of appropriate size, weight, and type of the specific worker exposed to the hazards. Like for example, of course, for the healthcare setting, you need your coveralls and masks and face shields, as mentioned earlier. But in your non-healthcare settings, like for example, in your construction industry, you would need your hard hats, your safety boots, safety belts, etc. So failure to provide appropriate PPE in high-risk activities shall give rise to the right of worker to refuse to unsafe work. Okay, so provide necessary company policies. These are the duties of the employers. Of course, they have to ensure that their sources for their information dissemination to their workers must be coming from reliable sources like DOH, DOLE, etc. So provide these materials that the workers need to remain healthy in the workplace and to make it safe. Designate a safety officer to monitor COVID-19 prevention and control measures. Of course, the employer can also enhance health insurance provision for their workers. As mentioned earlier, provide shelter service or decent accommodation on near-site locations to lessen travel and people movement when feasible. And enjoin the hiring of the local community and put up a COVID-19 hotline or call center for their employees. So we'd also like to, again, as mentioned in one of my earlier slides, increase physical and mental resilience by emphasizing their everyday actions to stay healthy, eating, of course, nutritious food, drinking lots of fluids, having adequate rest, exercising regularly, and to maybe encourage our companies to provide free medicines and vitamins, provide referral for workers needing counseling and presenting with medical or mental health concerns. So for assistance and reporting, the TTI and the DOLE will extend, of course, their support to all workplaces, employers, and workers complying with the guidelines. Okay, and the employer shall provide the DOLE through its regional office, copy furnish the DOH their monthly reporting of illness, disease, and injuries utilizing the DOLE work accident illness report form. Okay, so these are the different agencies. As I mentioned earlier, that the Philippine College of Occupational Medicine will always be one with and working together with and always aligned with. So as an organization, our mission of working with management and the workers to safeguard, promote, and maintain, enhance the workers' health, wellness, and safety. We want to promote this and make sure that our employers, our employees have their confidence and their trust for their occupational health physicians and their company physicians as well. Thank you. Thank you for your kind attention.
Thank you very much, Dr. Ria Fajardo, for that very comprehensive lecture on making our workplaces safe for our patients, our workers. Just, just again, reminding everyone that our webinar series is can be accessed through, sorry, can be accessed through this URL address. Let me just check this. Some of you might be requesting some handouts from our speakers. Perhaps you can just watch the program again via YouTube. The access to this URL link is also available at the PCP website as well as the PCP Facebook page. You just we have a few minutes for some questions. Uh, so while we still have our experts with us, uh, I'll be asking the questions. By the way, sorry. One question here is on dentists uh, doing procedures that generate uh, aerosols. So how can they protect themselves? Can anyone, Nina, can you take that question?
So yung best answer dyan is to be prepared to wear N95 masks at the least. So for our dental clinics, we will be again using our terminology at PGH. This is like level 3 to 4, requiring N95 mask and then the gown, gloves, and face shield. And
How
then the
about
area should be well ventilated. The clinic should be very well ventilated uh, with the uh, arrangement for almost what looks like negative pressure. So, mas maraming air pumapasok tapos hinihigop palabas.
oral prophylaxis? Uh, Oral prophylactic solutions. Is that recommended prior to the procedure for patients?
I don't know if the dentist group will have recommendations of that, but as far as I know, there's no specific gargling solution that is better than others. I
Mm.
would think they would be using some kind of disinfecting gargling solutions. But whether one is better than the rest, I'm not very sure of that.
Uh, One other question. Would you recommend limiting the duration of our clinic and limiting the number of patients to that we see per clinic session?
Hmm. So actually, I've heard of recommendations that would lead to that conclusion. Maybe we should just see 5 patients at any given clinic time. But I think it's really on a patient to patient basis and on a physician to physician basis. So I think it depends. It really depends on what your clinic is capable of doing and what kinds of patients you see.
Okay. Uh, One last, since you're on the line already. Uh, how about alternate work schedule for staff? Is that recommended? Like
Mm.
giving them a period of work, and if so, how long should we give them?
So um I think our experience in PGH right now is that for the staff who's been seeing patients who are COVID positive patients. So these are staff whose work assignments are purely to COVID areas. We felt it best during the time that there was also community quarantine. quarantine. So there was a difficulty coming to the hospital. We thought it best that the staff will work for 7 days and be off for 14 days. That allows them to have to be on some kind of a quarantine. So even if without testing, they are okay at the end of the 14th day, then we're sure that they were not infected. But again, as we resume back to normal schedule, I think we will also go back to some kind of work, normalize a new normalized schedule. So uh, again, it depends on the different aspects of that situation. Again, yung transportation, and then the kind of work that the staff is going to do.
Is that also advisable for
Aldrin,
uh, yes. Is that also
Aldrin,
advisable for mm. Okay, sige. Go ahead,
sorry.
Nina. Go ahead, Nina.
Sorry. Baka no, during my lecture, I think some of you were asking that I seem to be uh, you might have misinterpreted what I was trying to say. So, the thing about clinics is sometimes we're really limited to the space, the windows that are available, the type of air conditioning available. So, um, there's I'm not leaning towards any kind of additional equipment na kailangan may UV or HEPA filter. I think the principle behind the clinic redesigning is to just make sure that the air the workspace air that you're breathing is clean and maintained clean, whether that means natural ventilation, nasa open air kayo, that's gonna be good, just like what we're doing with our COVID clinic right now. We're in open air, and I think that's very good. But sometimes our clinics are not, we don't have that luxury. We don't have an option. We're in closed spaces, walang windows. So that means you make an extra effort to assure yourself and your staff that the ventilation, there you are trying to achieve some kind of good ventilation. That means you're putting in positive natural air from outside, and then you're removing, whether it's by exhaust or by some kind of air purifiers or by a negative pressure mechanism, you're removing dirty air. Dapat may ganong movement of air in your clinic. And that's gonna be very life-saving for you. Yan. I just wanted to clarify that.
Okay, thank you very much, Nina. Uh, Dr. Cybele, you mentioned about disinfecting solutions. It's different from healthcare environments, correct? Compared to regular workplaces. Uh, can you emphasize that again? And there's a
Right,
question here about Lysol spray. Is
right.
that useful adjunct also as far as disinfection is concerned?
Okay, so just to reiterate, the dilution of bleach, no, of your household bleach, is really very different in the healthcare setting and in the normal non-healthcare setting. So let's say in school or in some offices, the bleach that you use there, or even at home, it's more dilute because we're not expecting a lot of COVID-19 patients, for example, or people who are very sick. So the bleach dilution for non-healthcare settings is really 1:100. The dilution for healthcare settings is 1:10. And remember that bleach is caustic, so it's actually a skin irritant. So you should be very careful when you dilute your bleach. Try to protect your eyes and your hands. No, it's really for just surfaces. It's not for intact skin. And then regarding the use of Lysol spray, if you look at the content of Lysol, it's actually alcohol based. So it really does work. But remember, when you spray when you spray with Lysol, make sure that you follow the proper contact time. It's supposed to dry by itself. Or if you want, you can wipe around the area you're trying to disinfect and then let it dry. So be cognizant or be aware that there is a contact time that should happen for that area to be disinfected.
Okay. Since you're an infectious disease consultant and you are also the head of the infection control committee, there's a question here on BP measurement for patients. How do we need to wrap the cough with any special material or use any special disinfecting solution for each after using it among our patients? Cybele?
So if you use so the BB cuff, if you have the BB cuff that's nice and like plastic like material, then you can just wipe it off with a disinfectant wipe, or maybe spray and then wipe it off with some alcohol. That will be enough after each patient. If you have, there are, I know, blood pressure cuffs that are cloth, however. So if it's cloth, that might take a little bit more of doing. I'm not sure if you can wrap that in any material at all, like if plastic, if it defeats the purpose of the BP cuff. I actually have not tried. But if you do have cloth BP cuffs, then maybe just wear gloves, because you can't wash it in between patients or whatnot. So wear gloves when you're using the BP cuff, and then try to wipe it off at least between patients.
Okay, thank you very much, Cybele. Dr. Ria, there is a question here on schools, no? On schools.
Yes, yes,
Well, yeah, it is also a workplace, but
yes, correct.
can you at least provide us with general guidelines about protecting our children in school settings? When we lift or relax the quarantine, then schools will open, and I think that's a very
Right.
valid question.
I know that is very much a concern, even for my own family. And with regards to the school as a workplace, we can still implement the same guidelines that the DTI and the DOLE also gave to us. Like for example, for social distancing, ensure that they probably would have to limit the number of students in a classroom, and they would probably have to also limit the number of hours that the student has to be in the classroom. Maybe not even the number of hours, possibly the number of days that the student goes to school. These would also have to be partnered with using of technology nowadays. And if the students are able to do online classes, then they would probably have to implement and of course do this together with physical classes. So aside from this, the teachers and the admin of the school should also ensure that the infection prevention controls are in place, your engineering controls, your administrative controls, etc. And probably the security guards will now be having to wear your mask, and maybe gloves also if they're going to be going through the bags of the students, if they're going to do that. And for example, everything I guess that was mentioned earlier can also be implemented in the schools. I guess the difference only is that since the students are supposedly expected to be physically present, then they have to, limit the number of days, the number of hours that these students are probably to go to school, so that they limit the possible exposure to a positive or a COVID suspect.
Okay. Thank you very
Okay.
much, Dr. Ria. There
Okay.
are several more questions. Unfortunately, we have run out of time. Uh, it's past lunchtime. Before we say thank you to our panelists, can we ask for words for your parting words? No, uh, pearls of wisdom, words of advice uh, for our readiness in getting back to work. Dr. Nina? Hello? Dr. Nina, are you still there?
Hello? Yes.
Any last words?
I yeah, we as physicians, we also really need to think about or rethink about going back to our clinics because not all our patients are COVID patients. We've been concentrating a lot over the last 2 months on COVID patients, but we need to remember that there are many other patients who continue to need our care. So let's rethink and redesign our clinics. There's a lot of opportunity for telemedicine, so let's work into like putting that into our clinic design and clinic operations. But let's also prepare for meeting our patients face to face. So let's plan accordingly. And good
Thank
luck
you
to
very
all of us.
Okay, thank you very much, Dr. Anina. Dr. Cybele.
Thank you very
And
much for attending this webinar. For everybody out there, I think the main messages are really to keep physically distant, but socially aware and socially available. Remember the 1 to 2 meter rule of keeping physically away from each other. But we can beat this COVID-19 and hopefully we do it all together. Please remember not to discriminate against people with COVID-19 and remember to uh, take care of each other out there in the non-healthcare setting as well. Thank you very much.
thank you, Dr. Cybele. Dr. Ria Fajardo, any last words?
Hi, yes. I guess I'd like to again emphasize the importance of our occupational health physicians and occupational health staff together with the Health and Safety Committee to work together with the employer, the employees, and other stakeholders in the workplace to ensure that health and safety standards are kept strictly implemented in the workplace. So by doing so, we will fight COVID-19 together and we will, of course, overcome this COVID-19 pandemic. Thank you.
Thank you very much. On behalf of the Philippine College of Physicians, as well as the Department of Health, we would like to thank Dr. Regina Berba, Dr. Cybele Abad, and Dr. Ana Sofia Fajardo for their valuable inputs in today's webinar. Thank you very much for your wonderful lectures. And we also would like to thank our attendees, our participants. Okay. Okay. We also would like to thank our attendees and our participants for joining us in today's webinar. We are going to remember our webinar is available for later viewing. Just follow the URL flash on your screen. Okay, a link is also available at the PCP website as well as the PCP Facebook page. On Friday, we will have another webinar on the new normal, and in that webinar, we will be tackling telemedicine and telehealth as well. So we would like to thank the committee, the Continuing Medical Education Committee of the Philippine College of Physicians, as well as the Health Promotion and Communication Services of the DOH uh, for helping us out with this webinar series. We hope that you can join us again in the upcoming webinars, and we hope that for those who have not seen the other webinars in this series, you can view them again at via YouTube. We wish everyone a pleasant day, and let us be kind to each other. Let us protect each other, and let us beat COVID-19 together. Good afternoon, everyone. Have a pleasant lunch.